You can't see, right? Everyone is standing. I'll try to show you. So all of the tanks, they look the same at the top, okay? They all have the 3 holes there. 1, 2, 3. Everybody see? This is the regulator. It goes on top of the tank, of course. Do you see there's 2 little prongs?
Yeah.
2 little teeth, we call it. So it just goes into those small holes. So it's easier so that you're not trying to line it up or anything. I like to just go to the bottom and then you work your way up till it slides in, okay? That's why you can make sure it's actually in place and it's not crooked. Once the teeth slide in, all you have to do is tighten your one side, okay? Till it's nice and snug. Now, do you see the arrow there? It's in the red.
Yeah.
Arrows in the red.
Yes.
Can you see on the camera?
Yes. I'm
If,
zooming.
if you see your arrow in the red, either your tank is off or it's empty. Yeah, you got it. So if you want to check if it's empty or just off, we have to open up the system. So you either have this one or some tanks will have the red. You might have seen on some patients to open it. So then you just give it 1 or 2 turns. You don't have to keep cranking it or anything like that. Now do you see arrows in the green?
Yes.
Arrows in the green. I'll bring it here for you guys. Arrows in the green. So this tells you how full the tank is. Full is about 2,000, so we'll never go past like to the 3,000 to the end. So the beginning of the green, okay? So the tank it's on, it's ready to go. You don't hear anything coming out because the dial is set to off. Yeah. So to turn, you just turn it. And this is how much oxygen is coming out and we set, okay? And then we'll put the nose piece on, okay? Now, questions so far? There is one alarm. I call it alarm, but it's not. You guys might have dealt with it. If you put this on and then you try to turn the tank on and do you hear like sometimes,
Scared.
I'll show you guys. So that all the time is, there is a little green washer there. Do you see? Little green washer? This little circle? Yeah. I'll show you guys. The little circle. Sometimes when you take the tank off and put it on a new one, or if it's old, it can crack. This can fall off, yeah. Or it can break because it's rubber. So if it's old, it'll crack. That's when you put it on, you hear so all the 99% of the time, it's the issue with this washer. So
Just check to make sure.
check
it's
the
there.
washer.
If not, sometimes we have extras
Yes.
on the hook for the key.
And then some other companies, they have them like hanging off of here as well too. So if you hear that, turn the tank off. So then you can take this off and check the washer itself, okay? If you can't find any extra washers, usually the patients will have them in the room and you just have to call the company. Just say there's an issue with the washer, okay? Beautiful, so I'll put it back and we'll tighten it. And then I took the washer and put it back on, and then you saw it doesn't or anything like that, okay? Questions so far about
I have a question.
Yes.
Even if you change the small one,
Yeah.
there is an issue for the head. They have to replace it for you. I have issue same thing.
with that?
Is
That's
the
an issue
sound-
with the
yes,
regulator.
We have
Yeah.
to
Yeah.
change all the head.
If
Yeah.
that's, usually that happens if it's old, if it gets dropped, if something breaks on the inside. If you try the washer and you change it, it's still doing that, like you said, it has to be changed, the whole thing.
Yeah,
But
so just give us a call.
yeah, just call the company who's available. Now, when you turn the tank off, there is always a little bit of back pressure. So I have the tank turned off. Here, I'll turn it on and off so you guys can see. So it's on right now. I'm closing it. So the tank is off, but the arrow is still in the green there. Yeah. There's a little bit of air that's still stuck here. It's just back pressure. So you can either just drain the tank, it'll go. Some patients, people, if you take it off early, you'll hear that little so you can just leave it on the setting the patient is using. The tank will drain on its own. Okay. Now, does anybody want to try?
No.
No.
I have a question.
Yeah, of course.
Like when we close it
Yes.
after we used it, which one do we close first? This one or the top one? This one?
Oh,
This one or that one?
the top one is the one that actually closes the
First.
tank, yeah,
Then that one?
then that one, yeah. Cause that will stop the flow like completely, yeah. If some people, if you're gonna use the tank like right away, they'll just leave it on off. So then you don't have to keep opening and closing. But if it's empty, then you'll need to put it on a different.
So closing that one will be enough?
Yeah. But when you close it, like I'll show you. If you just close it. Time out. There we go. So we're gonna open it. So it's on now, the patient's using it, let's say on 2. If you turn it off, it's off now, but do you see it'll slowly drain?
It comes
Yeah.
off.
So we're almost there, now it's completely off, yeah, okay? So it's a little bit of a delay, yeah. Cause if there's different staff and they don't remember the flow, sometimes it's easier just to leave it on that, so that they don't keep changing it as well too, okay? Alright, last thing, you can have it up or you can lay it down as well too. Most patients, if they have a wheelchair or walker, they either have the cart or they have a bag. Or they have a cart that can support the tank, they have a little holder.
So for this tank, it looks the same as the iFill, it's a little dirtier, don't mind the mess. These are refilled that we use, okay? This is refilled at home, this one's refilled at the depot. This one you have to use the key in order to open, okay? The only thing you'll see difference is that when you first get these, they have the green little protective, you know it's full. You just rip that off and you can put your regulator on.
Same regulator.
Same regulator you can use for both. Yeah.
Beautiful.
And then the only other thing, you might have seen, some people have green, some people have clear. Do you guys know the difference? No? Okay. Clear is for flows up to 5.
Oh.
Green is for above that. High flow is what we call it. So anybody that has a flow of higher than 5, we give them the green tubing. Okay?
Cause that when it cuts off the flow too much, the green one allows more.
Yeah.
No, I have a 5.
The green one is for high.
Higher
High
than
flow.
5. Yeah.
268, 213B,
What happened?
430.
Yeah, the big machine, it's kinda
one.
like the.
If somebody has this, but is using lower flows, it's not gonna hurt them. It's
The air,
fine,
yeah.
it's
Yeah.
just
Still-
we
you'll
typically
still
use
hear
it for
it.
high
It's
flow,
just-
so that
it
must mean that they were on a higher flow at one point.
So it's like,
But they
you can
still
set
have
it
the
to
tubing,
6, it'll be like
not at the end of the road. Yeah.
so it won't actually get these.
And the white one is for.
Flows from 0.5 up to 5.